My name is Jeff Cleofe, and I work as a materials
Mm-hmm.
coordinator in one of the hospital here in New York. Basically, as a materials coordinator, I take care of the supplies and the
Mm-hmm.
operating room specifically. Um, I make sure that we have enough supply for surgeries.
Would you tell us how this pandemic changed your view about your current job at the moment?
In terms of helping others, or sick people, it has
Mm-hmm.
not changed. But when it comes to preparedness, it it changed a lot because we we were not prepared for this, and especially when it comes to PPEs, and like ventilators and stuff like that. So I think in the future we have to think about what can happen, and be prepared about it so we can avoid this from happening again.
You think, like, since you're one of the frontliners, do you believe that you are being affected with this thing called stressors? You think you're stressed during during a spike of the number of people in the emergency rooms or stuff like that?
um there are days that I yes it's very stressful to see people suffering from this disease, and uh I just to be honest, to me, I just take it day by day and one day at a
Mm-hmm.
time, basically. So I don't overthink it too much. And also, if you're feeling stressed, just try to if you need to talk to someone and try to relieve the stress. Just call someone and talk to whoever, to your friends and families, or whatever helped for you from the past just to relieve the
Mm-hmm.
stress. you know do it.
How do you stay healthy at home on your personal practices?
Well, there's a lot of things you can do at home to stay healthy. First, of course, you have to eat a well-balanced diet.
Mm-hmm.
Make sure you exercise. Even though if you have a small room or space, you can always do exercise. You do sit-ups, pull-ups. Hydrate yourself, unless it's contraindicated. And also, deep breathe, because as we know, this virus attacks the lungs. So if you try to do deep breathing exercises, it would help your lungs to expand better and make you breathe better.
Mm.
Yeah, and also just avoid bad vices like smoking, alcohol, or e-cigarettes. Just avoid those. Stay healthy.
What can you advise to the people to prevent this virus?
um I would say to follow what the health officials are saying. I I know, uh, here I think everywhere, everyone's saying to always wash your hands,
Mm-hmm.
follow social distancing, try not to
Right.
go out, try not to go out if you don't need to go out, just go out if you need to, if you have to, buy your groceries and stuff like that, and come back home and try to make sure to just wash your hands.
In your hospital, who and when should people reach out to health professionals?
Um, it's hard to give an advice, because people try to really follow advice, especially when it comes to sickness, and I'm not a medical doctor. So
Mm-hmm.
but I would say, um yourself, and if you're not feeling well, call the doctor and see what your doctor says, or if you can't really tolerate the symptoms, then to me, I would go to the hospital, you know
Yeah, will there be like an emergency hotline number that they should know to contact to should there be any symptoms like, or I believe they have, right?
Wherever you live, I think your government put some hotlines that you can call. I'm
Hmm.
not sure. Just look into that. Just um, call. Just try to watch the news or search in Google. What hotline you can call, and see what they tell you to do.
Can I just ask, if you don't mind, if can you please at least provide us a little view of the current situation in your hospital right now during this
So
coronavirus outbreak?
yeah, what's going on is
Mm-hmm.
our hospital right now is really packed of COVID patients. I think it's not just our hospital for sure. It's all over the nation, but um, yeah, where people are, staffs are getting sick. Um, we need PPEs. We're still short of PPEs.
Mm-hmm.
Um, but in the positive way, people are, you know coming to volunteer, um, because like I said, people are other staffs are getting sick, and actually other people from states are coming, other healthcare workers from another state are coming to help. um, People are really sick. Some of them
Mm-hmm.
make it, and some of them don't make it. So, and all you can hear is, in the overhead pages, they're coding. Patients are coding left and right. So yeah, it's very chaotic.
You mentioned about the lack of PPEs,
Hmm.
a great need for that. I think you were able to answer that, but you have some thoughts?
Yes, so we have a lack of PPE. So basically, every we basically have to regulate it. Every day we have to make sure that staff gets only one mask per day, one
Oh.
N95 mask per day, and to use for the whole day unless it gets soiled. you know um but uh we do that in order to, like, have something for tomorrow. Otherwise, if we just let
Mm-hmm.
them use and throw the mask, every time they use it, then we're gonna run out of, PPEs. So I'm hoping that, um we get the PPEs that we need, because it's essential. It's really essential in, dealing with patients.
How do you manage to save lives every day?
I just think of the positive, stuff, to deal with the stress. Like, for example, people, I see people recover from this virus, and it's such, a relief when when you see them, gain their strengths back and go back in the community. And also, um, you see people, like, coming together, like, especially, like, charities, like helping healthcare workers, to, like, bring food for them, donate food
Mm.
for us, and also not just food, but also PPE. So, that helps a lot in, relieving my stress.
Having said all that, would you say that there is an effect on mental health for the frontliners, and not only for the frontliners, those people who are also working in the back office, or um, those professionals just like you who are exposed to this pandemic case? Would you think that there is
uh
an effect to the mental health?
Definitely, definitely. uh, s- I see fears in like people's faces whenever they go to work, and I hear them say it, like, their anxieties like just goes so high with them. They're always scared. And also, um, not just for us, but for people who are experiencing the disease. They're scared, they don't know if they're gonna make it. And also for families who cannot even visit their loved ones in the hospital. um, and for people who lost their job, for people who lost their businesses, it can definitely affect people mentally. So yeah, it has a big effect.
Would you recommend any positive thoughts to you can impart with to our fellow for the
Okay.
entire, yeah, for the community? Yeah.
Yes. So, well, I just want to say that I know it's been hard for the past for the past month now because of what's happening. But I know we're gonna get through this. We have to stick together and listen to the government and our health officials to what they're saying in order to combat this virus. Um, know that there is someone you can talk to. um,
Mhm.
yeah, just call the hotlines. For sure there are hotlines that you can call, that's been in the news. Or like I said earlier, just search and Google. um, yeah, and then just stay positive and
Mhm.
pray for people who are sick. And um, just, yeah, try to stick together. I
Okay.
mean,
Yeah.
keep your distance, but I'm saying keep your,
Yeah. Yeah.
6 feet distance. But, we can get through this by, like, following, dealing with patients, with COVID
Okay.
patients.
Yeah, but I thought that for this face mask, I thought it's only okay to use within 3 hours. You think so?
I
Is that correct? I
I
don't know. My
think,
friends just told me about that.
yeah. So I don't know how long you can wear it, but because of what's happening right now, like the shortage, we're trying to stretch it out because otherwise we're gonna run out. If
I
we
know.
just use it
Yeah.
on, in the duration it was supposed to be used. So yeah, so basically we're using it like for the whole shift, one mask for the whole shift, unless, like I said, it gets soiled, like,
Mm-hmm.
some, it gets
Yeah, I
dirty, then
understand.
we change it. Yeah.